The Heart Recovery Foundation is calling on the government to introduce a 30% subsidy on heart surgeries to ease the financial burden on patients battling life-threatening cardiovascular conditions. The foundation emphasized that thousands of Nigerians cannot afford critical heart procedures, and a government-backed subsidy could save countless lives by improving access to timely and affordable care. In collaboration with the Universal Basic Education Commission, FCT, the Heart Foundation is touring schools to provide early testing and diagnosis for heart conditions. Founder of the foundation, Gilbert Kiaka Good News, who also had a hole in the heart but was treated in India, has vowed to tour 200 schools in the FCT. He made this known in Buhari Central Secondary School, Buhari, Abuja.
Heart-related conditions should be subsidized because it's very expensive. If they cannot pay all, they should subsidize, especially those that were born with it, that you don't acquire your conditions as a result of your lifestyle. They should subsidize it so that they can easily access the right treatment. So we are going to take the message around the country, but starting from Abuja, which is the center of the country.
You know what our hospitals are? They are like today. You can hardly go there and get attention, especially those of them that are in a national health insurance scheme. The government can do a lot. It wouldn't take anything to establish a heart-related hospital specialized in heart treatment. So it's something we can do if we really want to give it the best shot.
Nigerian government have enough to come in to assist this work by sponsoring the foundation, assisting them financially, or providing equipment to aid their service. They can, kind of provide support in terms of finance too, to carry out the treatment by, supporting hospitals that carry out such services.
All right, we just finished talking about the Heart Recovery Foundation calling on government to introduce a 30% subsidy on heart surgeries to ease the financial burden on patients battling life-threatening cardiovascular conditions. And I have joining us in the news the founder of Heart Recovery Foundation, Good News Kiaka Gilbert, and the lead doctor of the Heart Recovery Foundation, Dr. Chidozie to talk more about the activities of the foundation in secondary schools around the FCT here in Abuja. Gentlemen, glad to have you join me. So give us just a brief overview of what this Heart Foundation is. What necessitated it?
Thank you for having me.
Yeah, Gilbert.
Yeah.
Good News or Kiaka? Gilbert.
Yes. Based on my personal experience, my ordeal when I was having the problem of a hole in my heart, I was born with it, and I grew with it. In short, all my life I've been sick. I used to have signs that something is wrong with me, because I no access to adequate medical facility. I went to so many hospitals, tried to diagnose my problem. I couldn't. Not until when I became a presidential awardee and I got a job in Abuja. So I was able to foot my own bill. From there on, I went to so many hospitals in Abuja before I was. In short, to diagnose was not easy.
Yeah, let me even because you said you were born with it.
Yeah, I was born with it.
So your parents knew?
They don't know about it. They don't.
At what point did you discover that?
I discovered it just a few years back. When I was almost dying, I almost fainted in the market. My heart was palpitating like every time. I called a friend of mine. He's a medical doctor, a fellow presidential award, Dr. Adeleke. And he now directed me to a facility in Abuja here to be diagnosed. They saw that my heart was grossly dilated, but they don't know what was the problem. In short, what they saw there was quite different. I was now referred to another hospital, a very good hospital in Abuja here. And the hospital now tried to test me. The sonographers there, they tried their best. They couldn't see anything. They had to I have to wait for 2 weeks. They brought a pediatric cardiologist, a consultant.
You waited for 2 weeks? Were you in the hospital or out?
At home.
At home?
At home. I have to wait for 2 weeks when they brought a pediatric cardiologist, it was the person that when he came around, it was so easy. So he said the hole was already very big because of my age.
The pediatric, it's
yes.
a Nigerian.
Yeah, it's a Nigerian, yes.
Oh, okay.
It was very big because of my age. It was 3.7 centimeter. Very big, the hole. So I from there on, diagnosis is quite difficult. I was surprised myself. So I was very surprised that it takes so long for it to be diagnosed. And one thing again that actually moved me to set up this foundation was when I needed a medical report from a government hospital. I don't know if I can mention. I went to national.
No, you can't. Well, you can't begin to mention.
Okay, I went to a hospital, a big hospital in Abuja, a government hospital, and when I got there, to get this thing was quite difficult. I mean, the report so that I can travel for my surgery. It was a shock of all. And when I got there, the sonographers they were calling each other to come and see. Have you seen an adult congenital heart patient before? That is to say, children. I mean, children don't grow to my age mostly.
Oh, okay. So that's what has provoked this heart recovery foundation. And why schools?
Yeah, because school
and schools, young people, yeah.
Young people, it's a sickness that basically happens, something that happens to children. Before you grow to a certain age. That's why in that hospital, they said they've not seen someone at my age. In short, it was like they were calling the other people to come and see. That's to say they've not seen it before. Then what happened? That's to say before they grew to my age, maybe they passed. So catching them young, getting them young, try to fish them out at that tender age. I think we save a lot, we do a lot. Because when you get to a certain age, when they want to repair it, sometimes the heart must have gone through a lot of damage. And it's going to be very difficult to go through that kind of treatment at that point.
So, doctor, where do you come in when you people have to go to schools? Where do you come in?
Okay, thank you very much for this opportunity. Like you said, this condition go undiagnosed. It is stated that globally, 1 in 100 children come down with a congenital heart disease. One in 100. And it is also stated in Nigeria, over 70 children are born every year with a congenital heart disease. So to say that we have 192 every day. So you see, this condition has gone undiagnosed. It took a while for him to make a diagnosis of a congenital heart disease that he's been going through. He's had from birth. So you see, we need to wake up. The healthcare system is challenged.
Do we have, aside your Heart Recovery Foundation is now out to try to solve this challenge?
Yes.
Do we have specialist hospitals where this can be discovered in Nigeria here?
Yes. Well, first of all, we have a very poor screening system in Nigeria to enable us to diagnose this condition. And some facilities lack the equipment to make a diagnosis of a congenital heart disease. You need an echocardiograph. And this is the one that most facilities in Nigeria, in Abuja and also in Nigeria, do not have. You have to visit some cardiology center, some tertiary institutions for you to make a diagnosis of this health condition.
So back to you, good news. So now this is leading you to schools. You want to talk about 200 schools in Abuja. How many have you done as yet?
So far, we just started. It's not been long. I think we've done 2. But before doing that 2, we've been in contact with so many hospitals. Even like in FMC, Federal Medical Center. Currently now, they can perform that surgery. But it's open heart. They hack you open. And I think it has a lot of complications. But if I think we have the necessary modern equipment.
What has been the school's response to this?
Wow, they were so happy. In short, the last school we went to, Buhari Central, the principal called me the day after that day and was so grateful. Because in short, we tested a lot of students and we were able to maybe see 1 or 2 that is not doing well, having 1 or 2 problems, and we were able to give advice. They benefited not just for hearts. they have the opportunity to benefit from many other things and get the doctor advice on many other kind of problems. So I think we are still going to continue in the whole of Abuja. I have talked to UBEC and they've given me approval to continue. Like next week we are going to be in Gariki.
Okay.
From Gariki we are going to move on. We are going to continue to see how we can fish out these people that are having this problem very young, so that we can solve the problem.
And you talked about government introduce a 30% subsidy on heart surgeries to ease the financial burden on patients. Have you made any move towards government, or government has made any move towards you concerning this? Yes,
as we are starting, we actually, for now, we have some good government officials working with us, because we have some directors whom we have actually have a template of how we are going to move with our plans, because we need a subsidy, because this problem is not a problem you acquire, like I said earlier, as a result of your lifestyle. You were born with it. Yeah. And if you are born with it, most countries of the world, it takes not much. Like FMC, if you are going for open heart surgery, it's about 7 million. We have a pediatric cardiologist, a cardiologist, consultant cardiologist working with us from there, Dr. Alioke. So it's about 7 million. So you could imagine that if, let me say, 10 billion is given for that surgery, you're going to save up to 1,300 congenital heart patients. And that would be huge.
Among the 2 schools you've attended, I knew you were talking about, because I was going to ask that question. I hope it didn't run on my head. You were talking about diagnosis and not having the equipment. So what are you out of the students you've diagnosed, has anyone come out positive?
None, but we have people that are at risk, and we also counseling them. Okay, families, you have siblings that may have had congenital heart diseases, so we discuss with them and learn to know those other people around them, and also reach out to their families to find out the state of those children and what have been done so far.
Okay, that's quite interesting. If it's not treated quickly, what's the lifespan? I mean, the length that one can live. I mean, your case is a different case, because looks like there's what you could call divine intervention for you to have lived that long without diagnosis, and you still.
Yeah, I agree. You see, the doctor can talk about that one, because there are many types of defects, congenital defects.
And it depends on the time of presentation, the risk factors that are predisposed to the kind of congenital heart disease. So their lifespan depends on the state of presentation and how it's being managed, and the complications that also arise with it. So most times the costs and the treatment is what the care is what determines if the person will survive and the lifespan of that patient. So if it's left undiagnosed, like his case, we would have lost him, and thank God for the intervention. So the time of intervention or care depends on, it determines the lifespan of the patient.
Yeah, that's quite understandable. All right. Good news, Keka Gilbert, founder, Heart Recovery Foundation, and of course, lead doctor of the foundation, Dr. Chidozie Anomeri. Thanks for discussing this on Newsnight.
Thank you so much for having us.